That just sucks. We're talking about the areola grande. The more you know. Yeah, you can also get them in your labia. It's just really excessive because they could see them from space. Hollywood leads us to believe that pregnancy is this beautiful journey that everyone loves. But let's talk about the 5 things that might happen to your body that are a little less than beautiful. If you search this one out, you are probably expecting, so congratulations. And if it's a secret, I won't tell anybody. But the first thing I want to tell you about that might start to happen now that you are pregnant is nausea. Now, this is typically called morning sickness, but the truth of the matter is this can be all-day sickness. It can be month-long sickness. It can be every trimester sickness. This nausea may not just nail you in that first trimester. You may actually see it in the second, and then it comes back in the third. And some people are very lucky. They don't really experience any nausea, but some of us definitely will. Now, you know me, I'm not going to leave you high and dry. Here are some things that you can try if you do experience nausea in your pregnancy. First off, eat small meals throughout the day. One of the worst things that you can do if you're experiencing nausea in pregnancy is try to put back a Big Mac meal that is supersized with a large Coke and then a McFlurry at the end of the meal. Try to eat those tiny, small meals and try to incorporate protein if you can. Also, try to eat something small as soon as you wake up and right before you go to bed. I used to keep a little package of crackers by my bedside table. Then I would wake up and I would sort of crush back one with a very dry mouth, knowing that I didn't want to take it, but having that little bit of something in my tummy really seemed to help. There are also over-the-counter remedies that you might find, things that contain ginger, some bands that put pressure on certain points of your body. Definitely check in with your provider before you are trying any of these. Also, check in with your provider. They may be able to give you medications. Listen, nobody needs to be a hero here because throwing up is awful in the best of times, and throwing up while you are early pregnant or while you are heavily pregnant, that just sucks all the way around. So definitely speak to your provider. They do have special medications that are cleared for use in pregnancy that might help you with your nausea. If you're throwing up repeatedly or it's getting in the way of daily tasks, or maybe you're unable to keep down food or water, maybe you're losing weight, I want you to talk to your provider sooner rather than later, because at that point, it is likely no longer nausea in pregnancy. It sounds more like something called Hyperemesis Gravidarum. And if you'd like more information on that, let me know in the comments and I will get to work on a video for you. But with hyperemesis, a lot of times you do need to be admitted into labor and delivery, maybe for more intensive hydration, maybe for more medications to try to get you back up on your feet. And if you come into labor and delivery, you will likely see me there. My name is Tina. I am a certified perinatal nurse and a certified breastfeeding specialist. And right here on this channel, we do lots and lots of education with a sort of a side slice of humor. So if you are new here, please consider subscribing. And if you're not new here, thanks for coming back. Let's get back into the chaos with the next thing I want you to know about. Next thing on the list is tiredness. And you're thinking, yeah, Tina, of course I'm going to be tired. I'm already tired. Well, I'm not talking about the tiredness that you used to experience when you were 19 and you went out really late and then you had to wake up for your shift at Dairy Queen. That was me when I was 19. I am talking next level tiredness. I'm talking exhaustion. I'm talking hit in the butt with a tranquilizer dart. Exhaustion. It may hit you at the weirdest times during this first trimester. This is when it is the most prevalent. You'll be driving home and then 3:15 p.m. and you'll be like, I need to pull over before I absolutely fall asleep while driving this motor vehicle. Now, this might go away in the second trimester and you'll feel really good. You'll feel really energized, but then it might come back around in the third trimester. But that really has more to do with growing a whole human and a placenta and that amniotic fluid than it does hormones like it is in that first trimester. I'm here again to talk about your nipples. And I know it feels like we are always talking about your nipples here, but when we're talking about your nipples in terms of your body changes in pregnancy, now we're talking about the areola grande, or the pepperoni nipples, or the big bad baloney nipples. It feels very, very unnecessary, but our nipples in pregnancy, they're going to get bigger and they're going to get darker. And I've been told that this is so that your baby can find them, but it's just really excessive because they could see them from space. So if suddenly you have big bad nipples attached to your big, big pregnancy breasts, that is completely normal and completely expected. And as with most things in pregnancy, your hormones, once again, are to blame because as we see an increase in estrogen and an increase in progesterone, we are also going to see an increase in melatonin, which is going to cause that tissue of your nipples to get much darker. Also, fun fact, the skin around your nipples, the areola, they actually have little bumpies. They are known as Montgomery glands. And these Montgomery glands, they actually secrete something that smells like amniotic fluid to draw your baby in as you start your breastfeeding journey. And this is why skin to skin right after your baby is born is really, really cool. So the more you know. The next thing to come front and center is your vulva. We're going to talk about your vulva because there are quite a few changes that are going to happen down there now that you are pregnant. And I'm going to start with swelling. So just read my lips. Down there. Yeah, those lips. Those lips are going to swell up. And I mean, these lips are going to swell up too. And one of these is enjoyable and a much pleasant side effect of pregnancy. And one of these is much, much less pregnancy because swollen labia can be really, really uncomfortable, especially if you are sitting for a long period of time, like if you have an office job where you are sitting at a desk. So if you are noticing that your labia is getting quite swollen, you can do a few things. One is to put your feet up and relax. But for a lot of people, that's not really attainable. The other thing that you can do is apply ice. This is going to go for while you're pregnant and also postpartum. If your labia are swollen, ice is going to do you a world of good for those lips all the way around. Continuing to talk about your vulva and the changes it might experience during pregnancy, you may notice an increase in vaginal discharge. Now, an increase in discharge in pregnancy, it's very, very normal, but keep in mind that this discharge, it should be like white or clearish white, and it shouldn't smell foul or offensive. Now, during pregnancy, we have all of these shifting levels of hormones, and that can cause imbalances of yeast and bacteria in your vagina, which can lead to infections in pregnancy. So if you're ever feeling like something is off or something is not quite right, you should get it checked out right away. And the last thing I want to tell you about your vulva is varicose veins. And you might be thinking, yeah, like I got some in my lower legs. Yeah, you can also get them in your labia. You can have labia varicosities. I had these in my third and fourth pregnancy, and they were extremely, extremely uncomfortable. You can also get these in your bum area. They're known as hemorrhoids. Hemorrhoids also very, very common in pregnancy. Definitely chat with your provider if you're experiencing any of these things. They will likely tell you that you can use over-the-counter things like witch hazel or preparation H, but of course, chat with them before applying anything to those sensitive areas. You can also apply ice if it's really swollen, and you might want to look into compression socks and trying to elevate your feet throughout the day. And the last thing on my list of 5 body changes that might happen now that you're pregnant is something called lightning crotch. And if it sounds like the words lightning and crotch don't belong together, it's because they don't, or at least they shouldn't go together. Because the way I describe this to someone who's never experienced it, it's like you're just going about your day and there are flowers and everyone has a smiley face, and then your baby decides, yeah, it's time to wreck some stuff. And they give you a big Mike Tyson punch out right in the cervix. It is very sharp. It is very sudden. It feels almost like a nerve pain that goes from your vagina down your butt, down your leg. And the reason this happens is likely because as your pregnancy progresses, your baby's kind of floating down into your pelvis, which of course puts them closer to your cervix and the nerves around your cervix. It, makes it more accessible for them to have a good time with you throughout the day. Also, as your baby gets bigger, their kicks and their rolls and their punches get stronger, which could often make this lightning crotch sensation feel worse as your pregnancy progresses. Now, you can try sort of making any sudden movements a lot more gradual, but that's really kind of tough to do on the day-to-day. You can also talk to your provider about wearing a support belt, which will kind of keep the weight of your belly off of those lower limbs. I showed you mine, now you show me yours. What are some things that happened to you in pregnancy that really, really surprised you? Also, if you have a better description than the one I gave for lightning crotch, throw that in the comments so we can just sort of let everybody know what that feels like. If you want a video all about the changes your baby might go through once they are earthside, check this one out here. Please consider subscribing. And as always, be happy, stay healthy, have fun.